This medication is used to treat certain allergies that may occur seasonally or year-round. It is an extract of certain plant pollens that can cause allergies. Before prescribing this medication, your doctor must do lab/medical tests, such as skin or IgE tests, to learn what you are allergic to. This pollen allergen extract works by making your body less sensitive to the pollens, such as ragweed, grasses, that cause your allergies. This medication will not work right away to relieve allergy symptoms. When taken as directed, it may help relieve symptoms such as sneezing, runny/stuffy nose, cough, or itchy/watery eyes that are caused by allergies. The usual dosage is 1 tablet daily, placed under the tongue until it is completely dissolved. It is best to take this medication in the morning, at least 30 minutes before eating or drinking anything. Before taking this medication, make sure to read the provided medication guide. Take this medication by mouth without food as directed by your doctor, usually once daily. Remove 1 tablet from the package with dry hands, place it under your tongue and allow it to dissolve for at least 1 minute before swallowing. Do not chew or swallow the tablet, and do not eat or drink while it is dissolving and for 5 minutes after. Wash your hands after handling the tablet. If needed, an adult should help a child take this medication properly. Watch the child for at least 30 minutes after each dose to make sure there is no allergic reaction. Your doctor may direct you to start this medication at a low dose and gradually increase it to reduce side effects. Start taking this medication about 4 months before allergy season, and continue throughout the season. Take it at the same time each day to get the most benefit. Tell your doctor if your condition does not improve or worsens. Some common side effects of wheat Pollen-Short ragweed tablet, sublingual, include mild mouth, eye, ear, throat itching, throat dryness, irritation, cough, mouth or tongue swelling, or mouth blisters. These effects might occur especially during the first few days of treatment. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. If you experience any very serious side effects such as throat tightness or swelling, trouble swallowing or breathing, chest pain, or voice changes, seek medical help immediately. While a serious allergic reaction to this drug is rare, it is crucial to seek immediate medical help if you notice any symptoms of a serious allergic reaction. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not listed, it is recommended to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. It's important to be aware that in rare cases, this medication may cause a serious allergic reaction. If you notice symptoms such as flushing, rash, itching, swelling of the face, tongue, or throat, severe dizziness, fast/weak heartbeat, or trouble breathing, seek medical help immediately. After taking this drug for the first time, it's necessary to stay in a healthcare setting for 30 minutes so that your doctor can monitor you closely and provide help if needed. Your doctor will also prescribe another medication called epinephrine to use if you have a serious allergic reaction outside of a healthcare setting. Make sure to read the patient information leaflet provided by your pharmacist to learn when and how to use epinephrine, and seek medical help right away if you need to use it. People with certain medical conditions such as high blood pressure, breathing disorders like asthma, or heart problems may be at a higher risk for a serious allergic reaction. It's important to inform your doctor of all the medications you are using, including prescription/non-prescription drugs and herbal products, as some medications may make epinephrine or other rescue medications less effective or increase the risk of side effects. Before taking this medication, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to inform your doctor or pharmacist about your medical history, especially if you have breathing disorders, heart problems, high blood pressure, mouth irritation, a certain esophagus problem, previous allergic reactions, or if you are currently using other allergy treatments. If you are planning to have surgery or a dental procedure, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Your doctor or dentist may advise you to temporarily stop treatment with this medication after dental surgery or a procedure, so be sure to ask for details. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if this medication passes into breast milk. It's important to be aware of potential drug interactions with Pollen-Short Ragweed tablet, sublingual. This can affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. And remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important to seek help right away in case of an overdose. It's important not to share this medication with others, as it may harm them even if they have similar symptoms to yours. Your doctor may also recommend using other medications to help with allergy symptoms or mild side effects. This could include antihistamines or nasal sprays for allergies. Be sure to ask your doctor for more details about this. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your usual time. Don't take double the dose to make up for the missed one. Make sure to store the Pollen-Short Ragweed tablet, sublingual at room temperature, away from light and moisture. It's important to keep it out of the bathroom and out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.